So, Susan, you're here today. It's October of 2014 after I did your fusion surgery. And you are about 8 weeks after I fused your big toe, and I put 2 screws in there. And how are you?
Excellent, ready to go. My foot's never felt so good.
Oh, good.
Really?
So, how was the experience? Was the surgery very painful?
No after pain, nothing.
Okay. So, because you were in a lot of pain before, right? And I know that you also had surgery on the other foot.
That's right.
And the other surgery was okay long term, but you had pins put in, right?
Yes.
And then you had to have them pulled out
Yes.
after. So what do you think? Were the screws easier or?
Yes.
Yeah, I
Yes.
think so, because you don't have to pull anything out and nothing is sticking out.
No,
Right.
I feel more confident
Right.
because I know they're there to support the bone.
Exactly. No, I mean, I think that there's no right way and wrong way. It's just a preference.
Yes.
The only reason why I am not a big fan of pins is because sometimes people develop infections. We call it pin track infections.
Oh, right.
But honestly, they're both very widely utilized. There's nothing wrong with one or the other. So for a person who has arthritis in the big toe joint and is really suffering a lot, would you recommend having this surgery?
The screws, yes.
Well, even the pins. I mean, just fusion surgery in
Yes,
general.
definitely.
Yeah, absolutely.
The foot that was done a year ago, I've got no pain whatsoever.
Right.
And now this one, even in that short time, I've got no pain.
Good.
No
Excellent.
pain at
Well,
all.
you've been a very good patient, because I think that the key thing is also having patients who listen, and you did. And that's why you're better at such a fast pace. I mean, I'm actually surprised looking at your foot today that it's only been 8 weeks.
Yeah.
But of course, because I do my 50%, but if somebody doesn't listen and they start walking on it the day of surgery, guess what? They're going to ruin everything I've done. So thank you for being so compliant. I wish all my patients were as compliant as you are.
Thank you for everything you and your staff have done. They've done a wonderful job, and I recommend you to everyone.
Oh, thank you. We'll send you some patients.
I'm going to. You've already got one of mine, but she's having the Spanish lady.
Uh-huh.
One I